that I introduce the new Director General before I give him the floor to address you on this beautiful morning. So his name is Dr. Jean Kaseya, and he is the first Director General of the Africa Centers for Disease Control and Prevention after the African Union Heads of State elevated the organization to an autonomous health agency for the continent. He started his duties with us last week, and he replaces the inaugural director, Dr. John Nkengasong, who served the institution for 5 years. Dr. Kaseya is a Congolese medical doctor with over 2 decades of experience in public health, working at both international institutions and with the government of the Democratic Republic of Congo. He has a 4-year mandate to serve Africa CDC. So for today's briefing, the Director General will provide brief updates and also a general overview of the current situation of the COVID-19 pandemic and also other disease outbreaks happening across the African continent. The DG will also highlight his immediate priorities, outlining the strategic direction for Africa CDC as he assumes his duties. So it is really my honor to be able to welcome Dr. Kaseya. Bonjour, Director General, and welcome. You have the floor now to address the journalists who are online to listen to your briefing, after which we will go into the question and answer section. Over to you, Director General.
Thank you very much, Masita. And as you were saying, this is my first press briefing with you, and I'm so happy to be here as the new Director General of Africa CDC and the new face of health in Africa. And I'm so glad also to talk to you journalists because you are people who are making Africa CDC being known by our communities and our partners. And today we are celebrating this new Africa CDC with this autonomy and mandate, extended mandate, because you are supporting us. Then let me first start by saying good morning from our African Union headquarters in Addis Ababa. And thank you for what you are doing and for the wonderful job. Today, I wanted to give you some updates on the outbreaks that are occurring on the continent, including Africa CDC response efforts. Since the last briefing, we noted that there are 7 high-risk events that are ongoing on the continent. We still have COVID reported in all 55 member states. It means it's still a huge, important issue that we are targeting in Africa CDC. We have also Marburg virus disease in Tanzania and in Equatorial Guinea. We have the multi-country cholera outbreak. This one is in 15 countries, 15 member states. We have Burundi, Cameroon, DRC, Eswatini, Ethiopia, Kenya, Malawi, Mozambique, Nigeria, Somalia, South Africa, South Sudan, Tanzania, Zambia, and Zimbabwe. These are the 15 countries where we have this cholera outbreak. We have also the monkeypox in 5 countries, in CAR, Central African Republic, in DRC, in Ghana, Liberia, and Nigeria. In addition to these diseases, we have also the Lassa fever outbreak in 5 other countries, Ghana, Guinea, Liberia, and Nigeria, and Sierra Leone. The last one is the measles outbreak, and we saw the report released by UNICEF that the measles coverage and also other IVB, immunization, the other disease that we can prevent by vaccines, we saw that the coverage decreased. And for measles outbreak, we have it in 16 countries. We have the Botswana, Cameroon, Chad, DRC, Congo, Brazza, Ethiopia, Ghana, Kenya, Mauritania, Libya, Senegal, South Sudan, South Africa, Uganda, and Zambia. What is Africa CDC response to all of these outbreaks? As you know, we are working closely with our member states and also our partners to respond to these outbreaks. Regarding the Marburg in Tanzania and Equatorial Guinea, we deployed teams to support ongoing response efforts from member states and partners. Support was mostly in the areas of coordination, surveillance, and laboratory. For cholera, we provided technical support in case management, surveillance, infection prevention control, laboratory, and coordination to affected member states. And for monkeypox, we are continuing our support to member states, such as capacity building on surveillance and laboratory for early detection and case management. We are also continuing to engage with ministries of health to report cases to plan vaccine shipment for healthcare workers at risk populations and high-risk contact. I will not end the Africa CDC response without talking about the African Vaccination Week. As you know, this is the major opportunity that we have to target these children we didn't reach before, and even to increase the coverage in many countries. This year, the theme is the big catch-up. The big catch-up because we wanted to call on the African Union member states and all public health constituents to put a strong focus on reaching the most vulnerable communities with vaccines and to prioritize the integration of COVID vaccine into routine immunization. We have some countries doing that and very well. We are continuing to support this effort. We wanted also to renew our continental effort in strengthening routine immunization by reaching zero-dose children. And we know that based on many studies, these zero-dose children are now mostly in urban areas. And we want to achieve the vaccine equity. This is the Africa CDC response to all of these high-risk events that we described. And I think this is where I can end. But I understand also you wanted me briefly to give some priority and strategic vision for Africa CDC as the new Director General. Let me start by recognize the wonderful job of impressive people who are working with Africa CDC. Wonderful job. Ahmed, who to support after John moved to PEPFAR, and the whole Africa CDC team. I was so impressed when I started to see we have very skilled people, women and men, dedicating their life, their time, their energy for this mission. Then, for me, for sure, when you are leading a such respected organization at continental level, you have to bring innovation, but you have also to follow what colleagues they are doing very well. Let me first tell you that the new public health order is at the center of what I call New Deal. You know, in my manifesto was the title of manifesto is New Deal for Africa CDC. And for colleagues who had the opportunity to read it, they will find that the new public health order is at the center of our action. We have to continue under the 5 pillars. We are talking about the health workforce. We are talking about the financing of the health system. We are talking about the partnership. We are insisting on the what we call the respectful partnership. We are talking about to reinforce the local and regional organization to respond to all health issues and threats. But the last one, I wanted to put the last one because yesterday, together with Her Excellency, the DCP, the Deputy Chairperson of the African Union, we launched the meeting on the PAVM. It means this initiative to manufacture vaccines in Africa. And not only vaccines, we are talking about local manufacturing of diagnostics, of therapeutics, and vaccines. It means, as you know, in Africa, we are using only 1% of what we are producing. It means we are using, out of 100% of vaccines we are using, it's only 1% produced in Africa, to make it clear. Then we want to expand that from 1% to 30% and then to 60% by 2040. I was telling colleagues yesterday, 2040, I will be 70. I want to say to my children and my grandchildren that I managed with colleagues to make Africa more independent, learning from what COVID gave us as lessons. Then the new public health order is really the center of action. But another one is the autonomy of Africa CDC. For me, this autonomy, we got the administrative autonomy. If I want to deploy a staff for an outbreak, I don't have to go through the AU process and to get even the approval of the chairperson. You can imagine the number of people involved for the chairperson to sign a travel authorization. Now, at our level, we can sign and immediately the person can be deployed. We also, it's not just for travel, it's for procurement, for the HR hiring staff. It's for the financing of Africa. It's mostly how we are managing our funding. This is what I call the administrative autonomy. Now we have to move to the second level of this autonomy, what I call the financial sustainability of Africa. And we have some ideas we are discussing with key people and member states. This financial sustainability of Africa CDC is really the center of our action. It will give us opportunity not only to sit respectfully with our partners to see what are the needs of Africa and how we can collectively support that under the leadership of member states, but it also gives us some flexibility to support response to some countries when there is something or an event occurring. This is what I can briefly say about my vision. You can see you have the programmatic vision, everything under new public health order. And you have what I call the strategic vision, everything around the second level of autonomy, that is the financial sustainability of Africa CDC. And you will see with our mandate, we have a strong political mandate because we are working directly with head of state under the High Council of Africa CDC. We have 10 head of state sitting with us. We have also the governing board, where we have a number of ministers, 10 plus other partners. It means we have this power, the convening power. And when I'm talking with my colleagues, I say we are the umbrella of all health organizations working in Africa. It means our strategic plan must reflect the agenda of each agency or health organization in Africa. I will stop there. and welcome some of your questions if some clarifications are needed. Over.
Thank you very much. That was Dr. Jean Kasea, the Director General of the Africa Centers for Disease Control and Prevention, giving us a summary of the public health issues on the continent and also outlining some of his strategic vision for taking the organization forward. So colleagues, now we are at the time when we do our question and answer section. Let me give you the contact details for you to send your questions to. So first, you can come through directly on Zoom, either live or using the question and answer platform. Alternatively, you can use this WhatsApp number for today. Please note that it is different from the one that you usually use. So the one that you will use today is +251 93 569 2609. Please take note, +251 935 69 2609. Okay, let's go into our questions. And the first one that we have is coming from John Agaba. And John says he is a freelance journalist based in Kampala. He has about 5 questions, but for now I will give you 3 and then we'll come back to the other 2. So the first one, he says, kindly talk about the COVID-19 vaccination status in Africa. 1, how many people on the continent have been vaccinated overall? 2, how many have been vaccinated this year of 2023? And the third one, what is the number of vaccines that have expired because of lack of demand? So those are 3 questions for you, DG, from John Agaba. Okay, colleagues, I think we have lost the DG for a while, for a minute. I think he will be coming back to us soon. We do have some network and internet challenges that are going on, so please just bear with us. I'm sure he'll be back online very soon. In the meantime, I think I can just repeat that today we are using a different WhatsApp number for your questions, and that number is +251 935 692 609. We're also quite happy to talk to you live on this platform. Already I see that we have someone who's live. Let me just see who it is so we can just say hello. It is Paul. Paul, how are you?
I'm fine. Thank you very much. How are you doing?
I'm well. I'm very well, thanks.
Congrats on the new director. Is it back on?
Not yet. I think they're just trying to bring him back.
Should I wait till it comes or should I get back?
Yes, no, please just hold on. Yes.
Okay, thank you.
We are working to get him back online.
Okay, we're back on.
All right, so I see that the Director General is back online. Dr. Kaseya, can you hear me?
Yes, I can hear you.
All right, okay. Okay, so Doctor, I'm just going to give you 3 questions that have come through from John Agaba. And John is a freelance journalist. He's writing from Kampala in Uganda. Question, he says, how many people on the continent have been vaccinated overall? The second question, how many have been vaccinated in this year of 2023? And the third question, what is the number of vaccines that have expired because of lack of demand? So those are 3 questions from John Agaba. Over to you, DG.
Hello, you can hear me?
Yes, I can hear you.
Okay, go ahead.
Okay.
Please proceed.
Yes, thank you very much, John. You know, I just started and I'm going through the briefing of my colleagues. And we have a number of meetings discussing this issue. I commit to send to you the response to all of your questions immediately after the meeting, because yesterday we had another meeting and we are following up on this issue. Then I will give you clear figure that I think immediately after the call, because I will also ask my colleagues to help me to provide this information. I don't want to say what I have in my mind, because maybe it won't be accurate, but I commit to come back to you with the accurate figure. Please share with me your email address or phone number, then we'll send the answer very soon.
All right, thank you very much. And John, I would also encourage you, please, to also do the same with the rest of your questions, because I think you had about 2 or 3 more questions, so you could include them in that inquiry. It would also be helpful, I think, if you consulted the Africa CDC website, because some of the information that you are asking for here is available on that website. So we move on now, and we say hello to Paul Adepoju. Paul, we spoke earlier, but now please go ahead with your question.
Yes, thank you very much. And congratulations to the new director, DG, on the official assumption of duty. You've shared a lot about what's regarding your manifesto, and I think some of them are broad visions. And the first question I would like to ask you, as a healthcare practitioner and expert yourself, what are you worried about regarding public health in Africa, and what are your major priorities at the moment? Then top priorities in the moment. Then a third question I would like to sneak in is, in your manifesto, you had some interesting ideas. One of such is the hair tax, and looking at how things are working at the Africa CDC right now. How do you see these manifestos that would require a lot of interventions from individual countries getting on board with? How do you think these manifestos will be fulfilled, considering the political complications that could be connected with them? Thank you very much.
Thank you, Paul. Please let me first apologize, because I saw your email you sent me. I didn't answer to your email, but I committed when I will start as Director General, I will be in contact with you. Then this is the first opportunity for us to talk. Yeah, what am I worried about? You know, we are learning from COVID. In 2020, I was in Italy. I saw a number of people dying, while Italy is one of the countries where we have skilled healthcare workers, we have infrastructures, and we have even financial support from the government for population and hospitals. I was thinking that it would be a catastrophic situation in Africa. I was shaking every day. Even I committed myself to come to support Africa to build a kind of response to COVID, but there was nothing. And we saw a number of countries, Western countries, and even other countries that are not Western countries who are producing vaccines and medicines. They decided to keep their production for themselves. And Africa was abandoned. If the magnitude of COVID, as it was in some Western countries, had to be the same in Africa, I can say today we can count the number of Africans in terms of millions of people dying from COVID. Yes, we lost a number of them, but not as well, thinking that it could be. I'm thinking that COVID is not the last outbreak of pandemic. I'm thinking that we'll continue. I gave you the figure about some events that are occurring now in Africa. Then I'm worrying about the resilience of our health system in Africa. I'm worrying about the capacity that we have to make sure that we have sufficient skilled health workers, we have appropriate funding for our health system, we have this initiative of local manufacturing. It means vaccines, therapeutics, and diagnostics. This one must be in place. We are fighting for that. But I'm saying if we have another pandemic like that, while our systems, our health systems in all African member states are not so solid, so resilient, maybe we can face something more than what other countries faced with COVID. It means with colleagues from Africa CDC and with partners, we are running to see how to support member states to build strong health systems and to have appropriate support that can come from the member states themselves, but also other partners. This is what we are doing together with colleagues in Africa CDC to facilitate all of that. Regarding the manifesto, let me take it broad because airline tax is just one of the ideas we are pushing to make Africa CDC more sustainable financially. Your question is about how can I make sure that some ideas in this manifesto can be implemented and what this one will require. As you know, the process to recruit the new Director General was based not only on the CV interviews, but also on the quality of the manifesto that the Director General presented. This one, it was when I was candidate. Now I'm Director General. It means I have to translate this vision into action. And how can I do that? I am so glad and so grateful that we released a strategic plan, but that one was before I took position. Now what we are doing, we agreed internally with all colleagues and some partners, we are considering to update the strategic plan. not only to include ideas and vision that I have under my manifesto, but to take also into consideration, what all partners, even our Commissioner Minata, leading the HSS department, she has a strategic plan. But the strategic plan must speak to the Africa CDC strategic plan. This is an opportunity for me to say and to greet Commissioner Minata for the wonderful job she's doing. It means we started the process with support from Mackenzie, with support from Mastercard, we support Mastercard Foundation, with support from all other partners. We are going through that, and my sister, Dr. Moiti from WHO AFO, is supporting that, and my colleagues from UNICEF and other agencies. This one will help us to have an updated strategic plan that will include ideas that we are highlighting in our manifesto. When we have this strategic plan, we'll go to the governing board. The governing board is the governance structure of Africa CDC. We have ministers sitting there, and to sell this strategic plan for the buying, they will give us some input. And this input will incorporate that before going now to the High Council. This is also another governance structure. I explained, based on the new statutes of Africa CDC, we have the High Council of 10 head of state and the governing board with 10 ministers of health and other partners. If we go to the High Council and we have approval from the High Council, it means we have also the buy-in of High Council. Not only a structure, but we have the buy-in of 10 head of state, in addition to 10 other head of state represented by the ministers of health under the governing board. It means after driving this process, not only we have involvement of partners, but we have also buy-in of at least 20 countries out of the 55 countries. Then we'll be more comfortable to go now to the African Union governance mechanism to adopt that one and to request the buy-in. I will end by saying this is a consultative process. We are not imposing, it's not a top-down process. It's really a process that will bring everyone. We want all of us to say what is in the updated strategic plan of Africa CDC is also my contribution as individual, as organization, as member state. And at the end, you will see that they will be more comfortable to implement that, including the airline tax. Over to you, Paul.
Thank you very much, Director General. We now move on to a question that has come through from Sarah Jerving, and Sarah is with DEVEX. So Sarah says, thank you very much for the briefing, Dr. Kaseya. Congratulations on your new role. I am wondering if you can describe how the Africa CDC will work with the Africa Public Health Foundation under your leadership, and of course, in collaboration with its CEO, Dr. Ebere Okereke.
Thank you very much. It's obvious that I have to work with the Public Health Foundation. Let me first tell you that before even being elected, I was in contact with Dr. Ebere. I respect Dr. Ebere. And I want to say, happy birthday, Dr. Ebere, for even to congratulate her for becoming the CEO of the Public Health Foundation. We are meeting very soon. I think they wanted us to meet a few weeks ago when they were in Addis Ababa, but at that time I didn't take office, and I respect the organization. I can't talk when you are not substantive Director General. Now I'm substantive Director General, then I can sit and talk with colleagues. Look, I started to talk about the strategic plan. We have a number of constituencies, and Public Health Foundation is one of them. I know for a very long time, Dr. Bernard Aufiku, I was working with UNICEF in Namibia, and he was minister. We didn't just have professional relationship. We became friends. We are calling each other brother. And he was briefing me on that. Then I had the opportunity to talk with many other colleagues who are instrumental under this very important constituency. I know that they have a clear plan how they want to run their activities. My role is to make sure that they are involved when we are developing the strategic plan. And they also know where we are going, because the strategic plan is the 5-year vision for Africa CDC. If it gives all of us the opportunity to see where we want to bring Africa in the next 5 years in terms of health and determinant of health. Rest assured, Sarah, that if I don't meet Dr. Ebere, maybe immediately after coming back from the Mo Ibrahim Foundation meeting in Nairobi, I will meet her in Geneva, but we have opportunity to talk, and we'll then see how we can sit together and to be involved on that strategic plan we are developing for Africa. This is what I wanted to say. I won't go into details, but it's really a broad vision on how we can approach that, and are commit to work closely with them. Over to you.
All right, thank you. I don't see any new hands going up, but I see that Paul's hand is still up. Paul, is that a new hand or an old one?
Oh, yes, it's a new. Thank you very much. Another question that I think, another issue that people have been talking about around Africa CDC has to do with two key issues, which is the concept of One Health, talking about mainstreaming environment into policies. And Africa CDC had some interesting document released a couple of years ago, but I would like to know how whether you are thinking along this line in maintaining One Health in your strategy. Also, Africa CDC the African Union has also been aggressive about integrating, expanding the roles of women in policies and positions. So I'd like to know whether you are looking at gender issues, especially at the leadership at the Africa CDC. So what are your thoughts on gender issues at the Africa CDC and environment and One Health strategy? Thank you very much.
Thank you, Paul, for your two questions. These are critical questions. I take it seriously. For the first one, I want to ensure you that we are discussing the new structure of Africa CDC. You know, this new structure is coming from our priorities. I had a number of meetings with my colleagues, Dr. Ahmed and all HODs. Let me first tell you that we made a decision to appoint Dr. Ahmed as acting Director General of Africa CDC. You know, Dr. Ahmed was Deputy Director, then he became Acting Director, and now that there is a position of a Deputy Director General that is created, and we are going through the process to validate the new structure, but in the meantime, we needed someone to play that role. And then Dr. Ahmed, this is also my recognition of the wonderful job he's doing. You know, today I was calling him my guru. You know, he's the person who's really supporting me. He's the memory of institutional memory of Africa CDC after John Kenderson. It means I really need his support to to drive the agenda. Then I was saying we are discussing the new structure. And you will see under the new structure that we created some directorates. One of the directorates is dealing with One Health and environmental health. It means this is a strong agenda that we are pushing, because this one is also a key determinant of the health status in Africa. We saw what happened in Malawi, and we saw what happened in other countries. We really need to consider that and to make sure that we have a dedicated staff or team that can help Africa CDC to fulfill its mandate by having appropriate and skilled Africans driving this agenda. It's important for colleagues to know that we are considering that as a serious matter. And I discussed that also with Commissioner Minata. Went in Malawi to support our sisters and brothers who were affected weeks ago. About the second question, everywhere I was leading some offices, I had to make sure not only the women, the gender issue, but also the geographic balance, but also involvement of youth, to make sure that our structure will reflect the diversity of Africa. Just for your information, thanks to the autonomy of Africa CDC, now we have a committee sitting under the leadership of the Deputy Director General to oversight the recruitment process. Then this committee will send to the Director General 3-4 names depending on the candidates that they would have, and the Director General will appoint. It means now for Africa CDC, the appointing authority is the Director General. It means when I will have these 3-4 CVs, I will make sure that gender balance is something I will consider. I will make sure that youth involvement is something I will consider. We are sending our young people to universities in Africa and other countries. They want to have experience. And experiences come when you are practicing. This is why I will make sure to consider that skilled young people from Africa, and this is a clear message to some of them. I had to meet an intern working here who was asking me, Director General, what is our future as interns? I told her, we have your future here. We'll have staff, we'll have interns. We want to have more skilled Africans, being proud to work with the continental organization. But I also to make sure that I'm hiring from all regions of Africa. I don't want to have unbalanced structure, having just colleagues from one country or one region. No, I really want to reflect the diversity of Africa in terms of geography, and also in terms of language. Africa CDC, we are following the official language of AU. It means I need to have more people speaking Portuguese, speaking Spanish, speaking French, and English. This is how I will make Africa CDC representing the real Africa. It means I wanted to make sure that you will support me in this agenda, because this is the agenda of tomorrow. Maybe when we'll sit with you in very soon, we'll see that we made progress on that. Over to you.
All right. Thank you very much, Dr. Kaseya. It is now time for us to hear your 3 main messages that you would like the journalists to take away from everything that you've said. What would you say are your 3 most important messages that you want colleagues online to be able to grasp and to pass on to their audiences.
Thank you very much. I think the key messages are outlined on what I shared with you when I was talking about my vision. The first one is continuity by innovating. Why continuity? Continuity because I told you, John Henderson, I have to call him the founding father. You know, I was in Namibia, we respect President Sam Nujoma, and we call him founding father. And the founding father of Africa CDC is John Henderson. Yes, the champion is Moussa Faki. I was talking with Moussa Faki, you know, I was sharing with Moussa Faki, President Moussa Faki, that a few months before dying, I had the opportunity to meet Kofi Annan. And Kofi Annan was sharing with me that he did a lot, but something is very important in his life, and we consider his legacy. It's global fund. And I was saying to President Moussa Faki, you did a lot for your country, for Africa, but your baby is Africa CDC. Then, saying that we have to build on that, then to continue what John, then Ahmed, and other colleagues they did, by making it more innovative. What is this innovation? We discussed about the financial sustainability, we discussed about to push more the new public health product. We want everyone in Africa and the world to talk about the new public health product. To push under this new public health product the local manufacturing of vaccines, therapeutics, and biologicals. This is, I can summarize everything by that. Continuity by innovating in specific areas. Do you know also that the digital agenda is a critical one for us? We launched the digital transformative agenda, and I thank my colleagues who worked on that. This is something we continue as a cross-cutting area to push for that. The second message is Africa CDC belongs to all Africans. I want Africa CDC to be owned by African communities. I had to say to people, when you go to the US, you have PAO, WHO America, having the HQ headquarters in Washington. But when there is an outbreak or any health issue, Americans, they are saying what CDC is saying. We want, and we are dreaming, and we are working for that. Africans to know and to own Africa CDC. As Director General, I want to go to all villages, to all cities, and say, I'm Africa CDC. People will say, no. And when these communities are owning Africa CDC, then they will start to contribute. My financial sustainability model is sitting with the huge contribution of African communities. Very soon we'll come back to you. You'll see how we're structuring that. This is the second message. It means Africa CDC must be known and owned by African communities. The third one is about the diversity of Africa CDC. We need to reflect this diversity. I will make sure that what I gave you as criteria, like the gender, like the geographic balance, like the youth involvement, and all others, because I also need people who have disability to know that their place is here in Africa CDC. There will be no discrimination in terms of recruitment in Africa CDC. This is a clear guidance I'm giving to my colleague from HR department. These are the key messages. A strategic one in terms of autonomy, continuity, and sustainable financing. The second one, in terms of populations, communities knowing and owning the Africa CDC, and the third one about showing the diversity of Africa in Africa CDC. Thank you very much.
Thank you very much. That was the Director General of the Africa Centers for Disease Control, Dr. Jean Kaseya, giving us the brief on the situation of pandemics of public health issues on the continent, and also outlining his vision and concluding with those three very important messages as takeaways from today. So it is now time for us to end this briefing. I'd like to thank you all very much for having joined us, colleagues from the media and from the communications sector, and also to thank the Director General for his presence for the past 1 hour, and also to invite you all to join in again to this series of press briefings, because it is going to continue next week on Thursday at the same time, which is 12 noon East African time. For now, have a great weekend and have happy Workers' Day holidays on Monday.